Welcome to episode 6 of Expand Podcast. In this show, I interview Matthias Peper, owner of TPSOLUTION and founder of the TPAO Congress. To date, Matthias has treatment planned over 125,000 ortho cases for aligners. So he is a true authority and brings a very pragmatic perspective to this topic of TPS and collective intelligence. Enjoy it. Welcome to Expand Podcast. Today, the topic for this episode is going to be, in my opinion, a trendy topic, something that I'm very familiar, the TPS and collective intelligence, but I invited someone that I believe has more experience even, Matthias Peper, because this guy here, besides being a great friend, he is behind more than 100,000 cases planned in partnership with dentists, orthodontists from all over the world. It's correct, Matthias, 100,000, a little bit more maybe. You can correct me, but first of all, welcome. Thank you so much for being here for us to discuss this topic that I know you are as passionate about it as me.
Wow, thank you so much. And thank you so much for the invitation, for the kind words. And it's a big pleasure for me being here with you. And yes, you're right. It's until today, it's more than 125,000 digital treatment plans together with my team. Yeah, we have planned until today in the past 10 years. That's right.
So this is exactly what it is, the topic we are going to brainstorm today, right? This collaboration between a TPS, which means for those who are listening us, treatment planning service, with the dentist who is there with the patient, okay? So more and more I'm seeing this concept being applied in several clinics. This is the basis for my daily routine here at the planning center in DST. And I believe you are in this road for some years, right? I need to mention also that you are one of the founders of the TPAO Congress, right? Which is my opinion, is the best Congress about aligners that we have nowadays. I had the privilege being with you last year in Hamburg, your hometown, right? And it was really amazing. For sure, for those who are listening to us, they can go to the notes and see some links so you can go to the next one. You won't regret. So, Matthias, I like to say that what we do, the dentists, orthodontics, used to be in the past like an individual sport. But do we have space nowadays with all the technologies, everything we have available to continue this way? Or nowadays you can say that orthodontics more like a team sport, a team effort, a collective sport. What's your opinion about it, and how can you connect the TPS with this collective intelligence that more and more I can hear our colleagues discussing?
Yeah, so I personally really believe that orthodontics, it becomes more and more a collective sport, because we have the specialists, we have the orthodontist who really knows where he wants to go. Then in these days, we have a very complex software. We have a software where we can try out different scenarios, where we can find with all the specialists the perfect scenario for the patient. So I think in these days it makes sense if you have a specialist who gives you an idea about the software, about digital treatment planning, maybe about showing different treatment plans for the orthodontist, who can discuss this with the patient to find the best strategy. So in my personal opinion, these are the best days to find the perfect concepts for the patient.
Yeah, I completely agree, because imagine me as a dentist working in my clinic alone, right? An orthodontist, and actually this was me some years ago when I started, right? I need to plan a case And when you just graduate and you start practicing, it's tough because you don't have enough experience, and it's normal to make mistakes, right? So my decision was to work with a professor of mine for several years. It was like a post-graduation course for me, so I can gain trust and start doing the cases by myself. So it took me 10 years, this process, right? Making a lot of mistakes. So nowadays, having a TPS is like having a group of specialists working in your clinic, that you are listening to us, and having this support from people who are doing this every day, right? And completely connected to the latest advances, to the latest technologies from our systems. So this is an amazing jump in terms of quality, and to speed up this process, right, Matthias? I feel that you have, how many dentists nowadays are working with you, with your TPS?
Yeah, and it's exactly what you said. So until today, we have more than 500 orthodontists and dentists from all over the world. 10 years ago, I started my treatment planning service, TPSOLUTION, and yeah, we are really focused on complex aligner treatments to support the orthodontist and the dentist to get the maximum out of the software. And that's also the reason, as you already mentioned, why we started to create our own congress. So last year, it was the third time we had our TPAO congress. It means Treatment Planning in Aligner Orthodontic Congress. And what's so special in this congress is that on one hand, we have the specialist, we have the orthodontist, who shows all this clinical knowledge. He shows what he did previously to plan the case. But on the same time, we show all the secrets of digital treatment planning, because the software for today, it's getting more and more advanced, which is a big chance because you have a lot of opportunities. But on the other hand, you really need to spend time in front of your computer to really understand the software in detail. And this is exactly what I also explained at the beginning. I think this synergy of all experts, if we all come together, this is the future. And maybe this is also the reason why TPS and also the TPAO Congress is such a big things now. So we had more than 1,200 doctors from all over the world, and the idea is about learning about digital aligner orthodontics.
Yeah, this is a great example of collective efforts, right? Because the last Congress, I was there, as I mentioned. For every lecture that we saw, the orthodontist presenting his experience and cases. Right after came Matthias with his expertise to explain what happened in the software. So everyone could see both sides, the clinical outcome and the behind the scenes of the software, right? Because this is very rare. A lot of Congress, we can see only beautiful smiles after all, and very fast what is happening is hard for us to capture everything. So it's a great example of using the collective effort from technician and orthodontists presenting better outcomes, right?
Exactly. And sometimes it could be also frustrating for the orthodontist sitting in a congress and, reviewing amazing cases with, complex movements, medianization, crossbite correction, and the orthodontist sitting there and is like, okay, but I see that it's able to do it with the aligners, but I don't know how to program it, how to discuss it with the technician, which 3D tools to use and how to use it. And they want to go out and really understand the details, or understand if there is someone who can help me with that.
Yeah. One time I heard from a colleague orthodontist that he was kind of afraid that a TPS is trying to steal his job, okay, in an interdisciplinary clinic. The ST Planning Center works with interdisciplinary clinics. Orthodontics is part of the one piece of this puzzle, right? And the orthodontist in the clinic was kind of scared. Okay, but why I'm going to refer my cases to you? You're going to do my job here, okay? And then I kept thinking, and I don't think this is a fair way to think, at least in the patient's perspective, right? Because if there is the possibility of having more people behind, working together and not substituting, right?
Exactly.
We are putting filters to avoid mistakes, to prevent from unnecessary treatments. And this is something that I believe treatment planning service can add, to have like 1, 2, 3 more orthodontists, dentists, technicians working for me, orthodontists. So I can have more time to study, to go after more congresses, to read papers, to have more quality time with my patient, and not, as I did a lot in the past, to stay on Saturday, Sunday doing clean checks, right? Because during the weeks I didn't have the proper time and delay and everything for the patient. So I don't know if you agree with me, Matthias. Do you think, I don't know if you heard this also from an orthodontist, that I'm not sharing with TPS because this is my job, I don't believe it. What do you think about it?
I think at the end there's only one question. And this question is, what can we all do together to find the perfect solution for the patient? The best solution that is possible. And this is only possible if we work collective together, because we are specialists in software. So this is what we do every day. We have experience from more than 125,000 cases. So that doesn't mean that we do things better than an orthodontist. It does only mean that we do the things better in the technical way. We are the quality managers. We know exactly about the staging, about the velocity protocols. We know exactly how to position an attachment in a perfect way. But this is exactly what you said. So we need to see it as something collective to get the best for the patient. And so I personally think, if we can do better, even if we need 2 or 3 people from outside more, so let's do it. Let's put the patient on the top.
Daniel Ramos here, just taking a quick break from this podcast interview to tell you about the DSD Aligners course. I host a live stream course where I teach dentists how to treat all their orthodontic cases with aligners, from simple to complex, with clinically validated and science-based protocols. The course takes place over 3 weeks and has 2 weekly sessions, plus several recorded material with very special guests. Whether you are established Invisalign or clear aligner provider, an orthodontist, or a general dentist just starting out, this course curriculum covers the common challenges with proven systems. To get an idea of what the course is about, you can access a taster class free of charge on the web page that is linked in the notes of this episode. Be sure to check it out, and I hope to see you at one of these upcoming courses. Now, back to the episode. I want to create an analogy here that I think it's going to facilitate for those listening to us. Imagine you as a patient, and let's move out from the dental world. I use my example here. I have my right knee injured, okay? So what I did, I went to one doctor to have an opinion, and then he mentioned that the ideal treatment would be surgery. I didn't like to hear that, so I went to another doctor to have another opinion, and then to another doctor, and then I tried 1, 2, or 3. Imagine that if I visit finally a doctor that mentioned to me, okay, Daniel, I have a board of specialists that they are specialists in this treatment, and they are going to evaluate your case. And I have people from Germany, I have people from Madrid, and they're going to look all your documentation, your exams. We're going to discuss, we're going to approve together. And when we finally decide what is the best treatment for you, I'll call you and I'm going to present to you. That's okay. If I am the patient, I probably wouldn't need to go to another opinion because I was okay, everything just for me. And this is a powerful message, okay? First of all, we cannot understand or think that we know everything, right? We always have something to learn, and we always can use other colleagues to help us, right?
And also, and also, what I also need to say is that we all learn from each other. And this is also what I see with my team. And this is the reality, what I tell you now. With this 125,000 digital treatment plans, even today, if I discuss a new treatment plan with an orthodontist, it's always his input and my input. And this synergy brings the best treatment plan. And it also could be that I just show him two different versions. I show him, for example, one treatment plan with a little bit more interproximal reduction, another treatment plan, I don't know, just as an example, with a little bit more expansion, because I'm not exactly sure what clinically makes more sense. So we discuss it together, we take time. And at the end, the orthodontist or the dentist, he makes at the end the decision, very often together with the patient. So, and it's exactly what you said. The more professionals give input, in my opinion, then better for the patient.
So the question we were discussing, just to get back to this point, is it a individual or collective? It's clear that it's a collective sport right now, right? Even for those who are not using a TPS, they are using the technicians from a liner company to help in the process, right? Few doctors, they are doing everything by themselves. This is a topic for another episode we are going to have here. But for those who are using a company, they already are using collective intelligence, okay? But I suspect...
And also, and also, sorry to interrupt you, but it even was the same before. Before, it was the same situation. There was the orthodontist, and on the other hand, there was a technician, creating some appliances or something like that. And now it's the same. It's only a little bit more digital.
Yeah, for sure. And this collaboration needs to exist because I believe that we cannot do everything ourselves, right? It's crazy to think about it because first, we don't have enough time, unfortunately. We need to balance our life, personal life, work, and to try to do everything. I passed to this situation. It's complex and difficult to maintain for a long period of time. So even being me behind a TPS here in Madrid, when I was practicing seeing patients in Brazil, in my clinic there, I used a TPS service. So people ask me, Daniel, but you are the one there coordinating TPS. Why are you using the same service? If you are the one, they're going to look for. Because there I have more colleagues helping me. And then what I'm going to do, I'm going to do a final review, as you mentioned, that the orthodontist in the end is going to, he needs to understand. Okay, he needs to understand what is happening. If he agrees, he needs to personalize. I believe with time, a TPS and orthodontist, they get to know each other and then they start combining their efforts. So this synergy needs to exist if the orthodontist, the dentist, wants to have a better balance between work and personal life, right? So it doesn't mean, and I would like to hear from you, even though I believe I know your answer, but I would like everyone to hear, because is it possible to just, okay, I don't like orthodontics. My thing is prosthetics, is implant. But I want to do orthodontics with aligners, and now that we have TPS, I'm going to delegate everything to the TPS, and they're going to do for me, and okay, I don't need to worry. Do you think it's possible, in the end, to offer a good quality treatment, in terms of treatment, without following the other road, which is studying, looking for the information? Do you think it's possible to delegate everything to a TPS?
Yeah, it's a very good question. And I can tell you that in the past 10 years, my company exists. So we have about 20 technicians and 500 orthodontists or doctors we're working for. And 0 of our customers is like this. So they are all, because you need to like what you do, and also you need to understand what you're doing. So we are doing digital treatment service. But at the end, even if, we just deliver the aligners, the doctor needs to understand what he's doing, how to use auxiliary techniques, how to place a button, how to bond the attachments, what to do if the aligner is not perfect anymore. So this is absolutely not possible. So we are a treatment planning service. We are helping to deliver a perfect digital treatment plan, which is predictable. But at the end, the doctor needs to be motivated to do aligner orthodontics.
Yeah, in this journey, Matthias, I feel that the final destination for everyone is to provide the best care possible for the patient. So the patient happiness is the goal, the target, right? Is
Yes.
where we want to get. And we have 2 clear roads in front of us. One is, okay, I need to be an orthodontist. I'm going to do a post-graduation, master degree. I'm going to study, I'm going to learn. Okay. Some doctors, they look to the other road like it was a shortcut, the TPS, okay, which is a great way to learn faster, in my opinion. So we have the road number 1 and the road number 2, right? But what I like to repeat is that the secret is the secret road number 3, which is the combination of both, right? Because if you go after the information, right, you do all the courses you have the possibility to go to the TPAO Congress, and also use a TPS service, you are going to learn much faster and with a great support from those who are doing this every day, right? And I believe this is why in your platform, in your company, you combine both, because you're not just offering plannings, you're offering education too, right? Tell me more about it.
Yes, exactly. So on one hand, exactly. So we have the TP company, that means treatment planning, TP Solution. It's called TP Solution. So we are doing treatment planning. But on the other hand, we have the TPAO Congress with every 2 years, and we also have the TP Academy. And we spend a lot of time, so it's a TP Academy platform where we have education for everything in detail for the beginner who starts using aligner software to understand everything, how to do the prescription, how to do the clinical preferences in a perfect way, how to individualize it for his specific needs in his practice. And of course, how to do treatment planning, how to use the 3D tools. But not only that, also what to do when the patient comes back in terms of monitoring. Because digital aligner orthodontics doesn't only mean I order some aligners, it also means to understand in detail what to do next. And it's not like, okay, I have 40 aligners at upper and lower arch, I give it to the patient and he comes back after 80 weeks. It's the other way around. It is like, we need to understand the monitoring. We need to understand, okay, this is the treatment plan. I need to double check if it's exactly the clinical situation. What can I do to reach this situation? Do I need to discuss with the patient that he needs to spend more time in wearing the elastics? Can I change the wearing time from 14 to 10 days, maybe to 7 days? Maybe it doesn't make any sense. I need to go back to 10 days. So it is like, it's just a difference of how to spend my time now, and I think it's very, very similar to what orthodontists did in the previous years with fixed appliances. It's just a new method to learn it. Yeah. This is my opinion.
We have a lot in common, and I believe we both identified as that since the day one, right? Because I am also working in a planning center, and we believe that the service we are providing is not a product that ends when we deliver, ends the relationship with our clients, the dentist, right? Because for every case, we are providing support, consultancy from the beginning to the end, offering solutions, right? And it's like a happy marriage, right? So until the end. And I believe this is the way a treatment planning service should be. And for those who are listening to us and they never used, I think one of the most important messages here we are answering. Okay, it's better to have more. Two is better than one. Three is better than two. So the more, the better. So if you have the chance, it doesn't need to be with DSD Planning Center, it doesn't need to be with TPSOLUTION, but if you have a partner, a treatment planning service that can help you, always is better than you alone making all the decisions. You have the responsibility, of course, the final call, but to share the decisions is much better, right? So it's clear that it's not individual sport, it's a collective. It's clear that we are not substituting, we are adding, okay, which is one of the questions I separated here, and we are answering as we are talking, okay, if TPS in this math, okay, it's a substitution or an addition. So we are adding more brains, we are adding more knowledge. And I believe you learn with some of your dentists who are planning with you as they are learning from you. So we are improving the protocols. We are increasing the amount of data that we are collecting, right? So I am fascinated about this number, 125,000 cases with a lot of different brains that you are collecting and seeing outcomes. And this is my next question to you. Do you have the chance to monitor the outcomes they are sharing with you or through a monitoring system? Because for you to help them to understand if it's good, if it's going well, how they are sharing this for those who are listening to us to understand how it works.
Yes, very good question. And it's very interesting because 10 years ago, I started my company, and I worked together with the first orthodontists. And at this moment, it was like, okay, I only have the chance to see the refinement, to discuss with the doctors the outcomes. Maybe the doctor sent me some pictures. And then we really tried to qualify that. So for the doctors we worked together with, so we educated them to always take everything at the beginning, in the middle, at the end. Doesn't matter if they do a refinement or not, that we really can prove our quality. And also we are living from the feedback from our doctors. And I can say that 95% of the doctors started using our service. They still work together with us. So this for us is the biggest, let's say, proof of concept that it really makes sense for them and for us to work together. And yes, so we see a lot of results because we also work together with a lot of key opinion leaders, orthodontists that present the cases on stage, not only on the TPAO Congress, on all different aligner congresses all over the world. And most of these results. So we worked on the digital treatment plans, and we see a lot of results, and we can also say that we can prove our quality in terms of reducing the refinement rate. Cool. And we did an internal survey, and we were able to reduce the refinement rates of the doctors we work together with an average between 22 and 28%.
Amazing. It's amazing data, and this is a great motive, a great topic to I don't like to say convince, but to make dentists, orthodontists to see with their own eyes the importance of adding this kind of service, right? Because we, the same way as you, we use the digital that in the end, the digital is facilitating everything we are discussing, right? Because it was very difficult in the past to have a treatment planning service for braces, right? So the digital, the softwares allow us to do this, to connect and to share data and to be able to plan cases together. And also, what we are doing here, we are doing what we call the quality control, the post-ortho quality control. So we start our cases planning the ideal, right? The most comprehensive solution. And after in the benefit, as you mentioned, in the software, we can go one way, it's not good, let's try the plan B. That's not a good idea. So the plan C is the one. So this is our final position for ortho. We have it here. So after you finish the orthodontic treatment or a set of aligners, we can export the STL, or we can take a new scan and we have a new STL file and we can compare. And we never did this orthodontics in the past, because what happened in the past, we plan a case, we ask the patient to do all the documentation, everything needed to evaluate properly. But most of the time, we were imagining an outcome. We are explaining to the patient, it's going to look like this other case, it's going to be good, it's going to be a class 1. And we were like class 1 driven orthodontists, but we couldn't compare because we don't have any reference, right? And by using the digital and by using these quality controls, and with the volume, you, us, we are not there yet. We are not in these numbers. We are using more for these complex interdisciplinary cases that involves ortho, but we have a more than 4,000 cases with DSD interdisciplinary that we are comparing what we plan and what we achieved. So this way, we are testing, proving that this protocol works better than this other for cases like this. And we now can say that, okay, it's better to use this instead of this old protocol, because we can see by X number of cases that it's working better. So
there was never a better possibility for really checking the quality. I 100% agree with you.
Yeah, and when the digital entered in the orthodontic universe, right? Initially, slowly, a lot of doctors questioning if this is more work than the benefit they would collect. So, but little by little, they were convinced that there's no other way nowadays. Okay, and I believe one of the greatest benefits of the digital is this possibility that we can connect and we can simulate and make mistakes in the computer to avoid making them in patient's mouth. Okay,
I agree.
Go in the same direction as the sentence you used to start, that in the end, what matters is the patient, right? So we cannot test drive anything in our patient's mouth. We can do this nowadays in the computer. So now,
yes, exactly. And also, sorry, but this is a very, very good point. Just as an example, how easy it is for the orthodontist, just as an example, to really check before if he ends up in a perfect intercuspidation and molar area, just as an example. So in a digital treatment planning process, this is much easier. So you have so many different perspectives. You can zoom as best as you want. So you really can, and sometimes, this is also something that we see, just to give you an example, sometimes the orthodontist is asking to end up in a perfect class 1, but he is talking about a perfect class 1 from a buccal point of view in the area of the molars and the canine. So now we distalize a little bit, and from a buccal point of view, it looks perfectly. But if we have another view, and if we check the intercuspidation out of the oral palatal view, now we can see, oh, from buccal view, it's a perfect class 1, but out of this position, the intercuspidation of the molars is getting a little bit worse. We need to use a little bit of distal out rotation and reduce the distalization of the 7, just as an example, to really end up in a better intercuspidation and not to end up in a TMJ problem for this patient in the next 5 or 10 years. And so we can be much more specific, in my opinion.
Yeah. Look, the detail you are going, how deep you are analyzing this minimal detail, and a person alone to do this for all the patients he or she is seeing is very difficult, right? To go in this level of detail. And here is another benefit of adding to your clinic a TPS, because you have people dedicated to actually training to see these minor details, preventing you to do a planning in a rush. If the patient complaining that wants to install the aligners and you have a lot of other patients to see, so you need to open space in your agenda in the night or in Saturday morning to do this, and sometimes we miss. I know, because even here inside the treatment planning service, we have filters, right? Quality controls, internal quality controls before the case leaves to the doctor, right? To check all these details. So maybe for one case, if any of you are going to put all your effort to do the perfect planning, it's possible. For 2 patients, possible. 3 patients, probably possible. But for 10, 15, 20 patients every day, every single week, every year, with this constant effort to do perfect, alone is impossible. This I can say for sure, right? So I'm glad that you mentioned this example, because this is what we are doing, right? We are going to the details using our experience, the amount of cases that we plan one way, and then you saw, okay, here is class 1, but in the buccal side is not good, and this is creating an interference. So next case, we need to look this angle here to adjust a little bit, inclination, torque, remove this content. So, and then case after case, we are improving, right? And using a service like this is adding these insights, adding these inputs, right, from the day one, right?
Yes, exactly. And what we also can see is that the software sometimes have it, or the algorithms, the artificial intelligence and everything, maybe has a different view, has a different idea, because there's always someone or something that programs this software, that puts together the algorithms and so on. And I know that we talked about this a little bit deeper in another episode, but what I just would like to explain is that there is always, let's say, a first digital treatment plan that we see, but we need to understand, to read the problems, and to read this digital treatment plan to really understand if there are problems, and how can we avoid them in an easy way? How can we do this quality management? And I 100% agree. So we have a checklist. And this is a very, very intense checklist because I want that all my employees are talking exactly the same language and they have the same signature that I have. Because of that, we need it. For me, it's all about quality management.
This checklist, it's gold, right? It's like your secret sauce, probably. This is your Coca-Cola formula.
Exactly. Exactly.
Amazing. And we are talking all this time here in this episode about our effort as human to be better, right? And we still have, now I'm giving a spoiler to all of you, the artificial intelligence, right? That can help, and if properly used, can be very powerful, right? And to better use, I know, because I have here inside the DST Planning Center, our CEO, Brandon, who is the person who understands more about it in the world, I believe. And we have a lot of possibilities, right? And again, combining this collective intelligence, a TPS, and a great usage of the best tools for artificial intelligence inside orthodontics, this combination is changing. It's a game changer, right? It's the digital and everything together. Okay, but you need to wait a little bit for the next episode, okay, with Matthias. It's a spoiler that we are going to go deep inside this topic and brainstorm about it and how it can be helping us, okay? for us to pack everything and to have our conclusions, Matthias, about TPS, collective intelligence, allow me to summarize a little bit what we discussed, right?
Yes.
The first thing I believe we agree is that there is no room anymore for the lonely guy, the single player, the individual. Now is the team effort time, the collective intelligence that is available. Okay, so orthodontics shouldn't be anymore individual sport as used to be in the past, right? I believe digital potentialized the collective intelligence, right? Because you are where you are. I don't know if you can share with us, but you are in vacations, and I'm here in Madrid, and we are here having this moment. In the past, it was impossible, and the digital also allow us to share, to have the best in each area, helping us from anywhere, okay, and everywhere. And we can use this to simulate several outcomes. So the digital is the catalyst for this change, right? And I believe what I would like to leave from my side, and I would leave for you to conclude, to share your conclusions about this topic. But my message is that don't be afraid of this concept of TPS. Don't be afraid of collective intelligence. Use it to be better. Use it to add. Use it to offer to your patient the best treatment planning possible, the best decisions, and use it also to learn. It's going to speed up this process. It's going to make you understand more about aligners even faster. You don't need to agree with me, and please let me know your thoughts about it and what you have to pack it up and for us to conclude this amazing topic, Matthias.
Yes, I 100% agree. And I am also very interested in feedback. And I'm always interested in feedback because this only with the real and truly feedback we can, we can become better and learn and maybe have some other thoughts for future. So thank you so much. It was, it's a great topic, and it's always great to be able talking to you. Thank you so much for inviting me.
Thank you, Matthias. It was our pleasure here. Thanks for participating in this project, the Expand podcast, a DST podcast that I have the honor to host and to have you here talking about it. I believe you are the one to discuss this topic with me. It was great. So I really hope everyone listening that you enjoyed, and I really expect you in the next episode. Okay? See you there.
Thank you so much.
Bye.
Have a beautiful day. Bye-bye.
Thank you for listening. Check out the links in the episode notes for further information on what was discussed during the interview. In the next episode, I will have another interview with Matthias Peper. This time on the topic of artificial intelligence versus human intelligence in orthodontics.